Hello, everyone. I am Zahra Sethna. Welcome. Thank you for joining this live stream. I'm the co-founder of Collapse Life and host of a weekly podcast by the same name. And I'm very pleased to be joined today by Dr. Stephen Goldsmith. He's a medical doctor, a psychiatrist, and the author of a Substack called MAiD Shrink, which is great reading if you get a chance. So hi, Dr. Goldsmith. Thanks for joining us.
Thank you, Zahra. Again, I appreciate being invited. I'm looking forward to it.
Yeah, it's going to be a wonderful conversation. And just to set the context for people briefly. So you were very kindly a guest on our podcast a little while ago, a couple months ago. And a couple of the themes that we talked about were kind of medicine losing its soul and losing any sense of a divine dimension of healing. There were some really interesting ideas that came up in our discussion. And so when I read an article recently in The Atlantic about Canada's medical assistance in dying program, you immediately came to mind. I really wanted to know what your take was on it from so many different dimensions. So I sent it to you, and as suspected, you had some reactions, and you actually put out an amazing essay on your Substack called "MAiD in Hell: The Banality of Medical Evil." So today we're here to just talk through some of the thoughts and ideas that you laid out in that Substack, and just some of the things that come up in relation to the idea of euthanasia and medicine and the divine healing, all of that. So yeah, let us know. What did you think when you read that article?
I looked around for a barf bucket, actually. It was my first reaction. And it took me a little while to calm down for the steam to leave my ears. And then I thought, well, this is what it's all about. This is exactly where things are at right now in medicine, for sure, but also in our society, as just all kinds of events in other spheres of our society are showing, and they boil down. There are all sorts of factors which I could get into, but they boil down to two things: the loss of our sense of who we are, our humanity, and our loss of a sense of a divine power or authority, God. And so the MAiD program, I don't know how many of the viewers are already familiar with it, or even with that Atlantic article. It's gaining some currency now, some notoriety. But what it describes, a very good article, I thought, well balanced, more balanced than I thought it might be in the Atlantic. And what it shows is an incremental expansion of this program of, I won't use the euphemism, of medical care. They call it euthanasia. It's basically medically justified killing that started in 2016, when the Canadian government set up this MAiD program, Medical Assistance in Dying Program, for terminally ill people who were also unduly suffering or just simply even terminally ill. And that's how it started. It also started that way in at least a couple of other countries, Belgium and Netherlands, and a similar incremental expansion occurred in those as well. So it's not just confined to Canada. Canada may be the most egregious in terms of the rapidity with which it's expanded, the magnitude with which it's expanded compared with the others. But in kind, it's not so so different. So the program started for terminally ill people. It was in 2021, it expanded to include people who are not terminally ill, but who are experiencing, I think the language is something like irremediable suffering, whose condition was considered incurable. They weren't going to die from it. So they were included. Then an additional, I don't know, codicil to the program was introduced, in which people's conditions could be considered incurable if the treatment that they wanted did not help them. So it didn't mean that the condition was incurable for any treatment that was provided, but only for the treatment or treatments that they wanted.
So in other words, if a doctor offered a patient a therapy and the patient refused that therapy and said, no, I don't want to do that. I don't want to do surgery. I don't want to do chemotherapy. I don't want to do radiation. What other alternatives are there? Maybe there's one and it wouldn't cure the problem. Then that person could qualify. Is that correct?
Yes. And so it's continued to expand. And this is almost the textbook picture of slippery slope. The legislature passed a provision so that in 2027, the MAiD program would apply to mental illness, and you wouldn't have to have any adjunctive physical illness. So mental illness would be the sole criterion. And now that's happened a little bit already, that people are being killed because of mental illness in Canada, but they've had to work around the current requirements. You can't call the reason for it mental illness. That's not allowed yet. You have to wait until 2027. So there was a case I read about, maybe even in the Atlantic article, in which a man was very depressed and he the MAiD program, but he didn't qualify yet because of mental illness. So they killed him because of the justification that he had a hearing loss. So they've gotten around that a little bit even now. Now, even more hair-raising is the fact that a parliamentary committee has formally recommended that they include in the MAiD program, quotes, mature minors. And whatever that means, that's an oxymoron. Mature minors, and those mature minors who would be, their eligibility for the MAiD program and their killing through the MAiD program could not be vetoed by their parents. So it would be immune to parental veto. Parents could consult, but they couldn't. If you were a parent under this recommendation in Canada and your child was very ill and the government wanted to kill your child, you would have no legal right to stop them. So that's a further increment. The program itself, as you can imagine, because it deals with human beings who are very complex entities, it's been rife already with all kinds of difficulties and obstacles and obfuscations. The people who apply for it, in many instances, are not applying for it specifically because of some irremediable medical condition from which they're suffering greatly per se, but about half of them apply because they don't want to be a burden on their family. Almost half of them who apply. Others apply just because of old age, and they decide, well, they've had it. They're old enough. to do that. Others apply because they cannot afford the kind of treatment or diagnostic tests that they would need. Otherwise, they can't afford it, or they can't get access to the treatment that might benefit them, which is a big problem, as I understand it, in Canadian healthcare. I think it was that article that cited one has to wait in Canada for general surgery, whatever it is, about almost half a year, 22 weeks, I think. And for orthopedic surgery, heaven forbid you should need
A hip replacement.
a hip replacement or a knee or something, you'd have to wait more than a year. So those were reasons for people to apply, namely the actual deficiencies in the either social support or the medical system, not because they were inherently incurable. Now, this gets to a subject that really got me angry, and that was that the rationale for all of this is because of, quotes, autonomy, the need for people to have autonomy. That is the reason that's given.
So why does that make you bad?
Well, it's a kind of gaslighting term that in which the government is conferring on people what the people want because the government feels they deserve it or need it, not that it will enhance the people's own self-governance, governing their ability to take care of themselves. In fact, it's the opposite. It makes of the supplicants to the program dependents rather than people who are autonomous. And my view of autonomy is that it's the ability to self-govern, not an entitlement to receive. It's the analog would be considering sending people public welfare checks to support their autonomy. It's the same.
So I'm going to ask just a bit of a pushback question. So if we take the government out of the equation in this, and question the idea of autonomy, should people not have the ability to decide what they want to do with their body or their life in all cases? So is the hairy issue the fact that the government is providing this service?
The government, yes. That it has to do with the government acting as if they care about the people, when in fact there are various examples that indicate it's not that at all. It's more about control and power. So it's a kind of a shell game. But yeah, people can have the right to decide what they want to do themselves. But what happens is the government, I consider this a kind of instrumental empathy. This is an example of instrumental empathy. It's not that, you really feel for somebody because of your genuine feeling for them. It's your communicating empathy and compassion so that is, in my view, to depopulate people, to save money when the government expanded the program to people who were not terminally ill. It estimated that it saved about $150 million annually. of public health costs. And here's one example of where I consider they kind of gave the game away, in which in Quebec, it's now permitted for people to make advance requests, advance requests to be on the MAiD program when they become too ill, when a certain benchmark is reached. So if somebody starts to have some cognitive impairment, well, when they're no longer, let's say, able to recognize where they are, or they can't recognize their family, or they're not able to eat on their own, whatever it happens to be, and they specify that, and then they're put into this advanced request segment of the MAiD program. In Quebec, so far, it might spread to other provinces possibly. Now, the problem that they found at times was that people who put in an advance request for MAiD changed their mind, and sometimes in belligerent ways, or in very contentious ways, when the day was approaching or the hour was approaching when they were going to be killed. And so an association of Canadian physicians has come up with the proposition that, well, in order to prevent that inconvenience of people changing their minds about wanting to live, which would be an example of autonomy, of genuine autonomy, they should be sedated with benzodiazepines as the time approaches to make it the transition easier. Now, that doesn't sound to me like autonomy.
That's very chilling. It's the idea that there's a money savings aspect to the government, which is bound to provide health care and is now actually providing death care, is the one that really, sticks in the throat. And this is a topic that I agree with you, first of all, that the Atlantic article did a very good job of laying out the issues in a fair way and a balanced way, and bringing up things without putting a point of view on them. And so I read this and I think about this issue a lot, and I struggle with aspects of it. I know how I feel about certain parts of it, but I do struggle with aspects of it. And this idea of autonomy is one of them, because we've just come out of a global pandemic where there were mandates that people were told they had to do certain things with regard to their health. And you and I had discussed this, these are things that we don't want to be told. We should all be able to decide what we want to do. And so doesn't this just take it to perhaps an illogical conclusion, but to a far end of the spectrum? If the government was not providing this service and somebody decided, my disease is intolerable, it's incurable, I don't want to be a burden on my family, I don't want them to see me suffer and die when I can leave with a little bit of dignity. Before this was offered by the Canadian government, people would have the choice to maybe fly to Switzerland and go to the Dignitas clinic, or if they couldn't afford to do that, then they wouldn't really have a choice, and they might have been limited to pretty ugly options. So would a private option be better than the government providing this service? Or in your view, is this just not a path that people should be thinking about?
Well, these are great questions. The Hippocratic Oath that we're supposed to honor explicitly proscribed euthanasia, very explicitly, that you shall not give poison to anybody, nor recommend that to anybody else that they give it. It's very explicit.
That's amazing.
And it was revised in 1964. It's been since revised further, but it was revised in 1964 in a really kind of watered down, what I call mealy-mouthed way. So they didn't mention any more gods or goddesses the way the original Hippocratic Oath did. from ancient Greece. But what even the 1964 version said, one must not play at God. So that whichever oath our profession honors, whichever variation of it, these are violations of our oath. Now, for millennia, physicians have faced this dilemma with patients privately about what can I do? This person is suffering, has a terrible disease. Nobody has any cure for it. And at times, been winks and nods about, well, I won't do quite as much of this to sustain. I'm not going to outright give them an injection to terminate their vital functions, but perhaps we'll ease off some on some of the eating, go a little harder on the pain medicine, so they're in as much comfort as possible. Which doctors, a lot of doctors, because of everything that's happened about narcotics, have a bit of a phobia about giving too much pain medicine at times. But there have been ways that private physicians with their patients have kind of negotiated this without outright them, although they might have hastened the end of it. And so that's a gray area. But absolutely, euthanasia is proscribed by our oaths. Now medical students, they don't swear to almost anything except woke values. None of this is even included in the oaths that they take. But
and you pointed out that they actually are writing their own oaths now in certain medical schools.
Yeah. So the central ingredient that is a problem for me is the government. Mm-hmm. And the government, if people haven't figured it out by now, then please wake up. The government acts as if it cares about you. The government does not care about you. It cares about itself. It cares about perpetuating itself, strengthening itself, expanding itself. The government does not care about you. They care in the case of MAiD. I'm sure some of the governments, like the Canadian one, are influenced by globalist imperatives. We've got to get the population down. They're influenced by financial incentives of saving money, which, by the way, gets to be a vicious downward spiral, because the less money they spend on decent health services, the more people are going to be probably asking for MAiD, which will further decrease the population and so it's the government. I don't think the government should be in the business of terminating people's lives, certainly for health problems, capital punishments, another issue. But for health problems, I don't think so, because the government's motivations are heavily freighted with all sorts of hidden agendas, political, financial agendas, and so forth. And so I think it's a huge mistake to have the government involved in this at all.
Yeah. I think there's so many slippery slopes to be sliding down here, but one of them is that even if we kindly offer the idea that these are legislations that are formed with the best of intentions and the right compassion level, there becomes the opportunity for very perverse incentives to be at play, because there are NGOs now and clinics set up to offer this service they need to do what they are built to do. So if there isn't enough demand for the service, they need to create that demand. And then the government is telling medical professionals that they must discuss MAiD as an option for people, whether you like it or not, whether, if you were practicing in Canada right now and you had a patient who would potentially qualify, you would be bound to have that discussion with them. And so there's a lot of very hairy issues at play. I'm just going to jump over to our audience because I say hello to everybody who's joining us and thank you. There are a couple of comments that I wanted to share with you. So Alicia said, I've also heard there's a failure rate and they end up drowning, but they're too frozen to convey that. So this is the patients themselves perhaps have been so drugged up that they aren't able to indicate that this wasn't successful or didn't go as quickly as possible. We know, as you mentioned with capital punishment, that these things don't always go smoothly.
Yeah.
And because it's a fairly new procedure, we don't have a huge number of doctors and nurses who have been doing this. There's going to be different levels of experience and certainly levels of failure rate. Any thoughts on that, Doc?
Yeah, this is an important point. It's been documented by the Canadian government that in an investigative agency, that there are close to 500 cases so far of what essentially are malpractice in the application of MAiD. And considering that there aren't millions and millions and millions of people yet using MAiD, that's a pretty high percentage of malpractice. And the types of malpractice have boiled down to either the doctor using the wrong drugs, which could in fact end up with some horrible situations such as the viewer mentioned, or in fact, in addition to using the wrong drugs, they don't consult with an appropriate specialist who is an expert in the kind of condition that the patient is suffering from. So that let's say it's a GP who's going to be about to kill a patient with some really exotic neurological disease, not consulting with a neurologist. So there have been about 500 cases of that. So yes, the people, because it's a relatively new program, and the MAiD's practitioners are very open about it. They're really continuing to discover new ways of doing it, that it isn't a settled art to be able to do that. Yeah.
The people who do this is another question from Alicia. Do those dispensing this end of life take the Hippocratic Oath? Are they the actual doctor who you would go to if you had a health problem that you wanted to be solved? The same people who are actually doing the MAiD procedure? She says, I hear they're actively training medical professionals for this act.
Yes, well, they are. As far as I know, they take the Hippocratic Oath. Yeah. There's no reason why they wouldn't be. Yeah.
One of the examples that really stuck out to me from that Atlantic article, and I think to you too, but it was one that I had even flagged to you when I sent you the article. There was a doctor who it seems to be there's just a small subset of medical professionals in Canada who are performing the majority of the MAiD cases. And there was one doctor who was in that group who said something to the effect of, if you don't think that life is given by God or some divine deity, then you also feel as though, it isn't God or that divine deity that takes life away. And he truly believes that
Yeah.
that he doesn't believe that there is a God or any divine entity, and so for him it is no big deal to do this. It's just like any other day in the office, I guess. Which really stood out to me because, and I asked you this, I think, um, if that is my doctor and I go to him because I have an ailment and I want his advice to cure it, but he doesn't think that I'm kind of special or have any divine spark in me, how is that going to affect his view of healthcare,
Mhm.
of
Mhm.
healing?
Yes. What are you actually doing? Um, is this just a lump of meat in front of you, a clump of cells in front of you? Um, what is it that you're actually doing? What is your transcendent purpose, if there is any, in your being there with this person? Um, are there any ethical uh, guidelines or strictures about how you deal with an actual human being,
Mhm.
as opposed to a clump of cells or a set of computerized web data? Yes, and this really speaks to what I've written about and we've talked about. There's been in my profession and also in society as a whole, of course, there's been a loss of uh, a sense of the divine, either within us or over us, and with that, a loss of our sense of humanity in any one of a number of ways. If I may go a little bit off topic, I think this is kind of amusing, but it's also relevant. The recent Cracker Barrel brouhaha
Sure, yeah.
about about their changing their traditional logo, which was of this kind of old timer man in overalls and leaning against a Cracker Barrel with the lettered logo, Cracker Barrel, next to it. So they changed it. They got rid of the man and they got rid of the Cracker Barrel. So no picture, just the words. And people were in an uproar about that, and they changed. They went back. They've rescinded their renovation of their logo. And when I thought about it, yes, one might wonder if this had their original change to get rid of the pictorial part of the logo with this a white man in an ad, God forbid, but a white man in an old white man in a countrified setting. If this had something to do with woke philosophy that wasn't diverse enough, but then they could have done something else, included people of color or women or men in dresses or whatever. But they didn't. They got rid of the whole thing. So to me, I think what upset people the most was this was a kind of abolition of humanity of their brand, and a kind of a deracination of the customers, that they were these are just people who would come in and pay their bucks for a product without any emotional attachment to the meaning of the product, which brand tried to convey as having something to do with home and hearth and country and um, uh, good, good male authority figures and grandpas and all of that. And so it got rid of that. And that's also what I see happening in medicine.
Mhm.
That's exactly what I see happening in medicine, an abolition of the humanity that used to pretty much define the practice of medicine, in which people go see their physicians for 7-minute appointments in these sterile examining room. Don't even sit down in a nicely appointed consulting room to talk at leisure with the doctor, but right away they're propped up on these examining tables with the sheets and everything. And a nurse comes in, then an aide, then a doctor for 5 or 7 minutes, and then boom, you get your prescription. And this reflects the public greatly diminished trust of the medical profession and appreciation of the medical profession. The polls show that the American populace has declined greatly in how much they trust medicine. And I think it has to do with that, exactly that. Just as in the Cracker Barrel, there's been a loss of humanity. And and this is going to unfortunately get worse and worse unless my profession puts its foot down and rethinks what it's doing with the AI. AI is going to take over more and more, and there's going to be not only no God, but less and less humanity.
Yeah, just algorithms running everything, and certainly, maybe algorithms can do a better job pretending that they care. I mean, if you've ever interacted with Chat GPT, it's very sycophantic, and it makes you think that you're so brilliant for coming up with these ideas. Maybe they're better than actual humans at actually pretending, but it does feel absolutely like there has just been this loss of seeing each other as human beings, as flawed as we may be, but caring and vulnerable and broken sometimes. I want to ask another thing, which is, not to put all the burden on the medical profession itself. What's going on in society as well that's also a contributing factor here? So one of the examples in the Atlantic article was a man who was diagnosed with a cancer. It was a curable cancer. And he said no, he didn't want any of the options that were presented to him as potential cures. He just immediately, as soon as he got the diagnosis, he said, I want MAiD. And the doctors involved in his case actually ran it up the chain to say, we've got to deal with this patient because he's refusing any kind of surgical or therapeutic intervention. He does have a curable cancer, who's a man in his maybe 30s or 40s. I don't remember exactly, but a young man with a lot of life potentially ahead of him. And they actually ended up contacting one of the doctors who was very instrumental in establishing the rules and regulations around MAiD in Canada. And even she was surprised that this person was going so gung-ho for MAiD rather than looking at any potential medical intervention. And she said to him, what if we could 100% guarantee that if you do something, then your cancer will be gone? And he said, you don't understand. If I do that, there will be pain involved, and I do not want the pain at all. I want MAiD. So he was opting for an end of life versus any kind of discomfort or pain or stress or anything like that. And he may be an anomaly, but I don't think so. I think that we've created a society now where opting out entirely is better than enduring any kind of misery. It's like we've coddled people so much that they can't encounter a hurdle without just wanting to give up.
Yeah. That raises various questions about that particular case. I'm wondering how much they worked with him on the not only the psychological level to understand just would make life so unworth living with any kind of treatment. I don't know if anybody did that. Also, I don't know how much they really explored potentially effective treatments that are in alternative medical practices that are documented to help with very serious medical problems. I don't know how much they did with that. So those are unanswerable
Questions, yeah.
questions. But I wonder about that. Um, and yeah, people in general in our society, and I hadn't really drawn a connection between people giving up and just wanting to end it all when they're suffering. But we've been spoiled, uh, and my generation has been maybe one of the most spoiled generations in the history of the world. We've had very little in the way of hardships compared, in general. I'm talking about the average compared with past civilizations or other places in the world.
Mm.
And we have a government that's been increasingly giving us more and more and more. So we feel entitled to more and more because the government has taken on that role of kind of being more and more of a wet nurse for us to take care of us, which was not
Right.
the original purpose of government. So people are just not used to hardship of any kind. I think that that is true. And kids are raised far more protected than they were in the past. Um, they've got to wear their helmets to go here, and they can go only there. And um, so I do think that there has been a change in our willingness or ability to tolerate hardship. Yeah.
Yeah.
Even as
Yeah.
regrettable and tragic as it can be with medical suffering, which it sure is.
Absolutely. And I think the other thing that we lack in society is just a very healthy conversation about death. I mean, talk about the incurable condition. I mean, it's the one thing that we will all experience, but we try to avoid it at all costs or avoid talking about it or thinking about it. And now we have a bunch of Silicon Valley technocrats who are trying to defeat it. And so we seem to have a pretty unhealthy relationship with the idea that at some point um,
Mm.
we will have illnesses that will take our lives, and some of those might be pretty ugly, and you might have to go through some period of time where you're not well, you're not healthy, and then you will die. And it just seems like we don't have the community aspect of dealing with that. I mean, we do have, and it seems like we should have um, things like palliative care and hospice that help people who are at their end of their life to do it through the least painful way. And so I wanted to talk a little bit about how those differ from this idea of euthanasia, because in Canada the palliative care and the hospice care is likely provided through the same mechanisms as MAiD will be. So it's the same institutions, but a very different approach.
Yeah. Well, the yeah, it's tricky. It's a gray area, um, and that the this gets into a really complex a can of worms that harkens back to the COVID fiasco, in which hospitals were working in lockstep with our government in this country, and I'm sure elsewhere, and they were doing things to patients as a result of either incentives, financial incentives from the federal government, or um, mandates from medical boards, which were strongly influenced by the government. So that's a a tricky gray area. And the only way I could see around the government's influence would be to have some sort of outside ombudsman type non-governmental entity that was permitted oversight over the integrity of these programs, because it's been well publicized over the last few years, especially in connection with the COVID, that there were active practices underway to actually euthanize people, because you got money from the federal government if your patients died of COVID, and that's a whole other thing. But I think you'd have to ensure integrity, and even then, it would be tricky to do so. You'd have to have some entity other than government, because otherwise, once the government is involved, then they can create incentives and sort of practice guidelines, and so that's. If there's a chat here that really that brought up a particular subject that's related. And that is organ transplants.
Yes.
And that in itself also brings up, for me, the issue of our losing our way in or being in touch with our humanity and with the divine. And I'll give you one example. In the New York Times, July 30th, there was an article. This was a guest essay in the New York Times. Quote, "Donor organs are too rare. We need a new definition of death." So these were 3 doctors practicing, I think, in the New York City area, who were proposing, in order to increase the supply of viable organs to be transplanted, that those patients who had been comatose were on life support. They were still alive. They were on life support. Have the life support stopped to see if their heart really would continue beating or not. And if it didn't start beating within 5 minutes, you have to do it very quickly, within 5 minutes, then the bodies, they would be declared dead, and then the bodies would be perfused artificially so that the circulation would start going again. So then the organs could then be immediately transplanted. They would be viable. They would have fresh circulation. So that's the time in which we're living.
Right. It's chilling because, yes, the idea is that there's a supply and demand issue. Again, there's a huge demand for organs. There's not enough donors. So we need to create that supply through changing the definition of what brain death means so that we can take the organs from these people who are not yet dead, but we think that they'll probably be dead pretty soon. And so let's take their healthy organs or whatever organs we can so that we can put them into that organ donation stream, which again is just a very frightening, slippery slope. And it ties in again to these ideas of incentives and there's a question actually from Alicia again asking, is there a financial incentive being given to the people giving MAiD or signing off on allowing a patient to have the procedure? Like, are they getting paid out for using certain drugs or for approving this procedure? Do we know?
Well, the doctors and nurses who actually perform the medical killings are paid. I mean, they're by, I guess, the Canadian Health Service. If doctors, if other doctors who actually refer people to the MAiD program, that I don't know. That's an interesting question.
Well, I mean, because we know in COVID that was happening. Even here in the United States, that hospitals were getting premium for patients who were put on ventilators, patients who were being given remdesivir, patients who were this or that. There were actually written out menu items of bonuses that they would be paid for using particular interventions, most of which ended up in the death of the patient. So, yeah. But I think it's a very astute question. I'm not sure that we know the answer, but it's definitely one that we should be looking into.
Yeah. So another instance connected with organ transplants. This is kind of even a little bit more horrifying. The Gates Foundation funded a project in India. It was reported just exactly a week ago in a journal, I'm not familiar with it, but Forensic Science, Medicine and Pathology. And the project is called the Baby Open Brains Project. And it included in the study 100 infants, newborn infants, who died in a neonatal ICU. Some as young as a month old, and immediately they were embalmed and their organs were harvested, and referred for some sort of database, so that for what exactly nobody really is sure. But yet that's another example of the gray area for potential abuse, and one wonders if in such situations the medical care might not be what it could be otherwise, because heck, if the infant dies, that'll be another subject for the study, and we all know how much money the Gates Foundation has and so forth. So there's a huge amount of room for abuse.
Yeah. The numbers coming out of Canada are also really shocking in terms of how much uptick there has been in MAiD, and it's something like 1 in 20 deaths over the last few years have been the result of MAiD. And that's a big number. And even you mentioned other countries like Belgium and the Netherlands, they have similar laws. Even they are not at that level. Like Canada is a bit of an outlier. It's running ahead in terms of how much demand and desire there has been for people to take this service. And it points a little bit to the next point that Alicia made in the chat, which is that is there a risk of cognitive dissonance if this idea just becomes normalized? And I think that's exactly where we're at. I think it's a very good point. What do you think, Doc?
Yeah, oh, absolutely. Absolutely. Yeah.
I mean, especially when we're just opening it up now to pretty much anyone can figure out a way to apply for MAiD. It made some sense in the case of someone who was facing irremediable suffering and imminent death. But now, you have people who are really in different situations. And as you said, the two cases that I wanted to talk a little bit more with you about were offering it to children and offering it to people with mental health. And I think that's one of the reasons why I think you're so uniquely placed to talk about this, because you're also a psychiatrist as well as a medical doctor. And, would you ever have thought that you'd come to a point where your psychiatric patients were being offered euthanasia as a solution to their problems?
Well, that really goes against everything that I've valued and work for. And the problem is that when a person who's mentally ill, let's say very depressed, that they're suffering a lot, it's very painful to be very depressed, and they see no hope, that there's no, that it's essentially irremediable as far as they're concerned. And treatments might be offered them, and they say, "Oh, that's not going to work. That's not going to work." And it's using, and this is all because they're very depressed. They're indistinguishable from those who would be eligible for the MAiD program, just because of the hopelessness that characterizes severe depression. So that by definition, people who are very depressed would be automatically eligible just about to go into the MAiD hopper, which is a very scary thing to contemplate, because there are a lot of people.
Yeah. Yeah, it brings me back to the article that you wrote, and I wanted to ask you why you chose to use the phrase "the banality of medical evil." Why banality? It obviously springs to mind Hannah Arendt talking about the banality of evil and how evil can just become normalized and procedural and bureaucratic.
Well, that's exactly why I chose it. I copied her title, and it's because these are the people who are involved in MAiD, both the clinicians, the doctors, and the bureaucrats are just regular people who are working within a system, and in a number of instances, is my guess, that they're not really in touch with any higher values, and they're just sort of going to the office so week and putting one foot in front of another, and okay, well, this is what the government says I can do, and I'll do it. So in that respect, it reminds me of the Nazi bureaucrats and Adolf Eichmann, who said, "I'm just doing my job. I'm just following orders." Yeah, the government's MAiD is okay, and that's legal, and this is how you do it, and fine. So that's why I chose that title.
Yeah. I think it says so much. And it goes back to the topic that we discussed when you came on Collapse Life earlier, but the idea that that medicine is more than just a job. It's more than just going to the office and being a bureaucrat. I mean, it's a higher calling and a higher purpose. And you wrote really eloquently about your time at Columbia Medical School and crossing the threshold to enter the building every day. There were words written above the door. Talk about that.
Yeah. Yes. The main entrance through which we entered the medical school every day was of the Most High. For of the Most High cometh healing. For of the Most High cometh healing. So, yeah. And it just communicated that we were there for high purposes, and to heal people, which is a different concept than just targeting one symptom or another symptom. Healing people well, and so that was what we saw every day we walked into the building. Yeah. At Columbia. Mm-hmm.
Not only healing, but the Most High, I think, is the key part of that as well. That there
Yes.
is a, you are among a select few through whom the divine is working in order to bring healing, and we really lose completely the idea of divine healers, of the amazing work that you do as a doctor when you just start becoming a sort of a bureaucrat who manages your death, manages your patient's death. Like that seems to be what this is leading towards. It's not about seeing people as humans with a divine spark who, at all costs, we should do no harm, but, do everything we can to heal. It turns everything completely on its head, doesn't it?
Yes. Yeah. And I think my profession has lost that.
Yeah. Yeah. And now,
And
I mean,
the public knows it.
yeah. There's a lot of with this loss of trust in institutions in general and in the medical institution specifically, there's also this sense of being coerced and not feeling as though your doctor is your partner in your health, but maybe that they're trying to push you in a certain direction towards a certain outcome that might benefit them. I mean, all these questions now come into mind, and that loss of trust is just going to have so many impacts economically and health and in our society. I mean, it blows everything up.
Yes. Yeah. There's kind of an amusing anecdote. When I was in medical school, and this was many, many years ago, but even then, the public was becoming more and more disenchanted. The golden age of medicine, we might call it, was like the 40s through the 60s, something like that. And there was an article published in a throwaway medical journal in which people were polled at the emergency rooms about who would they like to see most in the case of an emergency or life-threatening situation. And they gave choices of different doctors in their practices, or renowned doctors, or the top specialist in whatever. And Marcus Welby, remember Marcus Welby, who was a fictitious character on a TV show, who was genial. He was very concerned about his patients. He visited them. He got involved in their lives. Very kind but firm. So they picked him. He was the one that they wanted to see, because that's what people even then were yearning for, and still do.
Yeah. Yeah. It is incredible that there are still doctors like you who think this way and who have this integrity and this concern. And so that we're really grateful that you write the stories that you do on your Substack. We always read them eagerly. And I think it's just really important to point out that this isn't just a story about what's happening in Canada. This is really a warning for all of us in modern societies everywhere, that
Yes.
What's happening here, what's happening in Canada is really an indicative of a crumbling of so many different things at once, as we've just discussed over the past hour. And it's really why it's perfectly suited to the kinds of things that we talk about here at Collapse Life. So we're really grateful to you, Dr. Goldsmith, for sharing your thoughts with us.
Well, my pleasure.
Yeah.
One admonition to the audience: don't be afraid to say no. Say no.
Yeah. And talk about these things, I think, with others. I think it's, it feels like this topic specifically, but it's an example of so many other topics. They're so highly charged politically, emotionally. There's this idea of autonomy, as you mentioned, and sort of the misuse of that word, the manipulation of the idea that we should be compassionate as a society. All of these sort of stifle just a rich, robust discussion about this topic. And so I think it's it's great that those of you who joined us for this live stream are here, and we thank you for sharing your thoughts. But it's really important to have these conversations in real life as well, and not be afraid of what someone might think or how they might react, because we don't have to agree on everything, and we don't have to tell people how to feel or how to think, but we should be talking about these issues. And it's exactly why we started Collapse Life. So yeah, that's my 2 cents. Yeah. Well, thank you again, Dr. Goldsmith. We truly appreciate it.
I appreciate it. Thanks very much.
And just to close, folks, we really appreciate you being here, and all the support on Substack and on YouTube and on Twitter. We started Collapse Life 2 years ago today for this very reason, to ask these questions and talk about the types of topics that nobody else wants to talk. And so talking with Dr. Goldsmith tonight really just reminds me why we do what we do, and why we'll keep doing it and having these kinds of conversations. This is what keeps us going. So thank you, everyone who's been part of our community for the last 2 years and who's been supporting us. We're running a special promotion for our 2nd anniversary. So new subscribers and free subscribers who upgrade to paid will get a special offer right now. And so we encourage you to go to collapselife.com to find out more about that. And we thank everyone for all their support. And we also encourage you to follow Mad Shrink on Substack. You will not be disappointed. It's wonderful stuff.
May I add the URL is stephengoldsmithmd.substack.com.
Fantastic. There it is up on the screen. Yes. Absolutely. So thank you, everyone. We hope you have a wonderful evening or the rest of your day, wherever you may be. And thank you again for joining us.